So I'm going to be doing the 3 stages of a patient with COPD. So when a patient has an exacerbation, they're going to typically come into the ED. On admission, he's going to complain of shortness of breath. He's going to say he has had a cough for the past few days. He's had an increase in sputum production. He's a smoker. He doesn't have any family with him right now, so he's feeling kind of anxious, but typically in mild distress at this point. Vital sounds, he's got diminished breath sounds all over. His heart rate is pretty normal at this point. Respirations are slightly increased at 28. Temperature is normal, blood pressure is normal. So we're going to get an ABG, and why do you think this is? So we want to get an ABG to see if he's retaining CO2 and to see how his O2 looks. So he is retaining CO2 based on his ABG. He's at 47 right now. His SaO2 is 90.5, so it is slightly low. CBC and Chem 7, we're going to obtain our typical labs to see, what his white count is. His white count's going to be elevated. We think he may have an infection. His hemoglobin and his hematocrit are going to be low. He doesn't have enough oxygen in his blood. Red blood cell count's going to be low. Potassium's normal. Magnesium may be slightly low. Otherwise, everything else looks pretty normal at this point. Chest x-ray, so why do we want to get a chest x-ray? Well, obviously to see, if anything else is going on, if his heart is enlarged, if he's got infiltrates in his lungs. So we obtained that. It looks pretty normal for the most part. He's got the typical flat diaphragm for COPD. He does have some mild infiltrates in his left lower lung. Sputum results. So we get sputum to see if he has an infection. He does. He's got Haemophilus influenzae. Pulmonary function test. Why do we get that? So it's a spirometry test that we do, and we obtain that to see his lung function, to see how well he's exhaling, the amount of breaths, or the amount of air that he's able to exhale, and how much time it takes him to exhale. So at this point, his lung function test looks very bad. It's very poor. Next. So we're going to alert the doctor of all these findings. He's in respiratory acidosis based on his ABG. We're also going to apply some oxygen if he drops below at 90%. At this point he is, based on his ABG, so we're going to apply 2 liters nasal cannula. Lab values. So magnesium, based on Kleinschmidt in 2016, he states that magnesium helps to produce bronchodilation. So the doctor orders 2 grams of mag to be given via IV. We're going to administer that. And then we start him on an antibiotic, levofloxacin, via IV, just because of the culture that came back, the sputum culture. Kleinschmidt also stated improved outcomes seen with early antibiotic treatment regardless of disease severity. We're also going to administer albuterol, and why do you think we do that? We administer that right away to help open up the lungs, to help bronchodilate, cause bronchodilation, and it reduces airway resistance so the patient can breathe easier. Next. So on the second stage, the patient gets worse. He calls us with his call light and says that he's having a hard time catching his breath. We come in the room, he's very confused and lethargic. His O2 is showing 87% via the monitor. His heart is racing. His family arrives and they're very scared and worried. So heart rate, he's tachycardic, he's tachypnic. We can see it in his face. He can't catch his breath. He's very scared. His breath sounds are diminished all over. He does have some wheezing on expiration. The ABG. So we obtained a new ABG after an hour of him being on oxygen. It's gotten worse. He's now retaining more CO2. His SaO2 is worse as well. It's now at 82. So next. So we're going to alert the physician of these new findings. The physician decides to admit him to the ICU at this point, and this is for closer monitoring. So the physician decides to start the patient on BiPAP, and why do you think this is? Well, BiPAP is a non-invasive ventilation. It's a step before intubating them. So he's going to see if this helps. If this helps to draw out the carbon dioxide that the patient's retaining, he's going to see if this helps him be able to breathe easier before we actually have to intubate him. So based on Diaz-Torres and Rodeos in 2011, they said that non-invasive ventilation showed a rapid improvement in pH, respiratory rate, and PaCO2 within the first hour of treatment. Also, it is a first-line therapy in COPD exacerbations. So that's why the doctor decides to do this. We're also going to administer Solumedrol, which is it helps to reduce inflammation. So we give that IV stat, and then we're going to also give a dose of albuterol, or not albuterol, Spiriva via the inhaler, and that'll help to bronchodilate as well. It's a short-acting or long-acting bronchodilator. We're going to educate the family because they're scared. We're going to refer them to a chaplain or social services. Next. So on the third stage, the patient's improving. He has been in the ICU for 3 days now, so we're getting to discharge him. We've educated him on all the steps he needs to take as far as pulmonary rehab, smoking cessation. We've discussed medications with him. We have discussed an exercise plan with him. We've talked to his family about what they can do to help. He agrees and feels confident he can do this. All of his labs look normal at this point. He now is able to breathe. He's feeling better. His chest x-ray is normal. ABGs are normal. We did a new pulmonary function test. It is normal. Breath sounds are clear. Next. So as far as interventions, we're going to continue him on the levofloxacin to treat his infection. We want to make sure he takes that for a total of 7 days. So he's got 4 more days. To prevent and treat his exacerbations, he's going to use a long-acting inhaler daily, and then also a short-acting inhaler if needed. Corticosteroids like the Solumedrol, he is not being sent home with this, and if he happens to have more exacerbations in the future, this is something the doctor may recommend. Reducing risk factors, so smoking is one of them, one of the major ones we went over with him, and that is it.